Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now, here is your host and founder of Laser Therapy Institute, Dr. Jason Roundtree.
Hey, thanks for joining me today. My name is Dr. Jason Roundtree, and I'll be your host again today. And it's a special day because this is the 1 year mark that we have been producing Healing at the Speed of Light podcast, which has been challenging and exciting, and I hope useful to you as well if you've been listening in. We started doing this podcast because I have gotten questions for years now about how we know that laser works, and patients that want to know more about the research that's out there, and more than anything, just about the exciting, changing healthcare environment that we are working in now with laser therapy, and the different things that it can do, the different things that we see it do every day in practice, and what we're seeing in research as well. So I thought for today, what would be kind of neat is to go back through the thousands of downloads we've had and select a couple of the top performing topics that we've covered, and then talk a little bit more about them and why they're interesting, and hopefully connect you with some additional episodes that maybe you missed. So check the show notes. You'll see additional links to other episodes about these two top topics from this past year. Now, the number one most requested topic and most downloaded episode were episodes about neuropathy. And we've talked about neuropathy a lot on this podcast for a lot of reasons. As a matter of fact, we have done 8 episodes on neuropathy and nerve regeneration, and I'd encourage you to go back and make sure you caught all those, because they all address neuropathy from different angles, different types of neuropathy, how it happens, how laser has been shown to be helpful. And I think this is an interesting topic for people because with neuropathy, you have a condition that is really bothersome. It can keep you awake at night. It can make you unsure of your footing. It can really take away the joy from a day when you're dealing with this continuous burning, tingling, and stinging either in the feet or the hands. And beyond that, there's poor outcomes for neuropathy, meaning that many patients with neuropathy develop ulcers, non-healing wounds on the feet that can lead to amputation. Or it increases the risk of falling. And when you fall, you open up yourself to risks of traumatic brain injury or broken bones. And that level of risk and vulnerability is something that many people are just not used to. And many times neuropathy can set in fairly rapidly, kind of seemingly out of the blue for a lot of folks. And then the next factor is that there are very few treatment options. So when you do have this start, you do start to notice the burning and stinging, and you maybe lose some of your balance, or you notice you're having a hard time telling where your feet are landing, and you go see your doc. Many times there is almost nothing offered for treatment beyond medications. And some of the medications can be addictive, they can be damaging as far as side effects go, and really they're only designed to quiet the symptoms some, and bringing the symptoms down is a good thing. Don't get me wrong. It's good to be able to sleep, and it's good to be able to focus on something besides the way that you are feeling. But at the same time, if you're just reducing the symptoms, you're not really preventing this thing from getting worse potentially, or from just being an ongoing problem and then being stuck on medications for years. So I think between the difficulty of the day-to-day life of dealing with neuropathy, plus the fact that there are overall bad outcomes associated with having neuropathy, with the non-healing wounds and fall risk, and then the fact that there are very few treatment options for neuropathy, the next thing is that I believe laser therapy is actually getting a little more popular when it comes to hearing about laser, with a focus on delivering care that can reduce the symptoms of neuropathy naturally, without medications, without side effects and risky treatments. Now, if you're just joining us, we're not talking about laser surgery, right? That is a different process. We're talking about stimulating the body's repair mechanisms using a lower dose laser that can deliver a stimulating effect by producing better blood flow to the nerves and also stimulating more production of cellular energy within those nerve cells so that they can function better and repair. Because the nerve pain comes from the nerves being starved of circulation and then being damaged. And of course, as a reminder, this podcast is not meant to be medical advice. I'm not going to advise you to go off of any medications or to seek a specific treatment, but just to say, we've got a lot of evidence that laser therapy can be very helpful for nerve damage and neuropathy conditions, and I would encourage you to get evaluated by a local health professional who does laser therapy. Now, if you're looking for someone near you that can perform laser therapy and that knows about neuropathy, definitely check into lasertherapyinstitute.org. That's our training and education organization that will provide healthcare providers a way to know how to use their laser for neuropathy in particular, as well as many, many other conditions. So you can go to our website and find out if there is a clinic near you. And if you can't find somebody there, there's a way to contact us so that we can get in touch with you and hopefully find someone to be able to help you out in your local area. But in the meantime, go to the show notes for this episode and definitely check out the other podcast episodes we've done on neuropathy, because you'll be able to understand more about how this neuropathy process works, why it gets started the way it does, and why laser is kind of uniquely suited for reversing some of the symptomatology of neuropathy, neuropathic conditions, nerve damage. All right, the second most in-demand topic that we covered in the last year was rheumatoid arthritis. Now, rheumatoid arthritis is an inflammatory arthritis, many, many times seen in the hands and the fingers, where the fingers become malformed and twisted. They can be very painful. It can happen in other areas of the body too, including the neck and the shoulders and some of the other joints. But rheumatoid arthritis is not osteoarthritis. Osteoarthritis is that wear and tear, degenerative change that can take place within any joint. Rheumatoid arthritis is the body's own immune system getting out of control and then attacking certain joints and kind of eating them from the inside out. It leads to a lot of joint damage and is very, very painful, very difficult to control. Many times those with rheumatoid arthritis are placed on a type of chemotherapy drug to try and reduce the amount of aggressive immune system reaction that's happening there. Now, as in many other conditions, medications can be very helpful, and these medications do kind of attack the cause of this disorder because you're reducing that aggressive immune response. So the chemotherapy drug can be something that really reduces the joint damage, the bone erosion that can happen with this chronic inflammatory response. But at the same time, as most of us know, there are side effects to chemotherapy, including, at times, neuropathy. So this is one where, in some circumstances, it might be wise to check into laser therapy. In my practice, personally, I've seen many patients with rheumatoid arthritis that were either able to avoid getting on the chemotherapy drug regimen or be able to discontinue it under their doctor's supervision because their symptoms improved so well. And again, with laser therapy, you're looking at almost no side effects. You don't have any medication interactions. When I say almost no side effects, the only side effects that really ever happen is a short-term increase in soreness and sometimes some fatigue. Again, all very short-term. But with rheumatoid arthritis, we have over 20 studies that have been done on rheumatoid arthritis. Now, there's some mixed results on those studies because we're still learning a lot about how laser can be applied to this inflammatory disease. But if you go back to the episode that we did previously, and we'll link that in the show notes, that episode talks about a study that is actually quite old and showed excellent results. So even for decades now, we've been having evidence that laser therapy can work well for this inflammatory rheumatoid arthritis condition. And in many cases, laser can be an excellent choice. So I would encourage you, again, go to our website, lasertherapyinstitute.org. You can find out if there's a clinic near you. If you can't find somebody near you, there's a way for you to contact us there, and we can help find someone in your area who should be able to check things out and see if this might be an option. As always, thank you very much for joining me. Happy 1-year anniversary to us on the podcast here. If you haven't done so yet, please scroll down and leave us a review. It's always helpful to be able to see some feedback, and it does help other patients and medical practitioners find this podcast as well. We're seeing more and more laser therapy being performed throughout the healthcare environment, and ideally, we're going to see more and more of that as more time goes by and more studies get done as well. Do you have a suggestion for us to do a podcast on? Do you have a specific subject you'd like to learn more about? Please send us a message. We're anxious to hear from you. But I'll talk to you next week.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.